Hello. So today I'm going to talk to you about lepto or leptospirosis, which is a bacterial infection that we do typically vaccinate for. It can be given alone or it can be combined with the DAP or distemper parvo vaccine. Recently, within the past 2 or 3 years, it was added to the core vaccines for dogs, so it is recommended for all dogs. It is a bacterial infection that typically they will get from encountering infected urine or tissue. That's kind of the way we talk about it. We tell people about puddles on the ground that the dog drinks out of, that an infected other animal peed in or whatnot, but there's lots of ways you can get this bacteria. I have seen many an inside-only dog come down with this type of infection. Typically, it will impact the liver and the kidneys. Statistically, it's more likely to impact the kidneys first and then the liver, but sometimes we do see liver patients that never have kidney issues with it. It absolutely can cause death if it is not treated. Testing for lepto is a little bit of a challenge, so a lot of clinics will have an in-house test, but it is not perfect. There is a little bit of issue with vaccines interfering with the test, so it just kind of leads you in a direction of if it's positive, it might be lepto. If it's negative, it's probably not lepto. The real testing for it or send out tests that can be a bit of a challenge because they can take some time to come back. So you're usually treating for the disease while you're waiting for the tests anyway. Treatment can range from just antibiotics at home to hospitalization with really intensive care and fluids, just depending on how sick the dog is. Lepto is a challenge even if they're vaccinated. The vaccine only contains 4 what are called serovars. It's essentially strains of lepto. So there are serovars and there are serogroups. There's about 10 serogroups of lepto, and within those groups there's about 250 strains of it or serovars of it. So we vaccinate for as many as we can, but we can't vaccinate for all of them. The biggest issue with lepto is it is what's called zoonotic. That means it can transmit from dogs to people. And people get a lot of the same signs with the liver and kidney failure. There's actually an episode of Monsters Inside Me, if any of y'all ever watched that, of a person that got lepto. Thankfully, got over it in the episode. But it is something that they have added to core vaccines because we're seeing a lot more of it than we used to. And it is a very dangerous little bacteria. So make sure to get your kiddos vaccinated for it.